Hello, I'm Miguel Toribio-Mateas, the Clinical Director at the Optimum Health Clinic, and today I'm here with Helen Lynam, one of the senior practitioners in the nutrition team, who's going to be talking to us about migraines, and particularly migraines in the chronic fatigue, ME and fibromyalgia community. Hi Helen, how are you today?
I'm great, thank you, Miguel.
Brilliant. So tell us about migraines and your personal experience as a nutrition practitioner.
Well, migraines can be very debilitating. We actually find a lot of our clients actually come to us with migraines as one of their symptoms. Migraines can occur for all sorts of different reasons. It can be specific nutrient deficiencies, it can be due to some level of toxicity perhaps, it can be related to their gut function and also to certain specific foods and how that's interacting with them.
Okay, that's interesting. Because we obviously ask our patients to fill out a questionnaire before they come to see us, and that includes a detailed dietary diary. So that obviously justifies the fact that you'll be looking at that in detail.
Absolutely, yes. There's this particular substance called tyramine, which we're always very interested to look for, as that can have an association with migraines. Not for everybody, because there can be all sorts of reasons, but for some people, particularly if there's a lot of stress in someone's life and they find that their migraines are triggered by stress, or for females who are menstruating at the start of their period, or just before, if they find that the migraines are starting then, that's when we think, perhaps tyramine has a role to play here.
Okay, and that's because tyramine actually is metabolized by a certain enzyme that is shared in different processes in the body, isn't it? Tell us a little bit more about it.
Yes, so tyramine on its own, if it's just left to accumulate in the body, will actually cause vasoconstriction. And of course, vasoconstriction is what it causes migraines. There is an enzyme which would normally degrade tyramine so that it's not a problem, but that same enzyme is used for some of our stress hormones and also specifically for estrogen. So if there's a lot of stress hormones, or if there's a lot of estrogen around, or there's a particular change in estrogen levels, that can consume all of the enzyme, leaving nothing to dilute the tyramine, leading to a build-up in tyramine, and hence the trigger of migraines.
Right, which is probably why females will have a tendency to have migraines around their cycle.
Absolutely, yes, and it can be why we do find more females than males have migraines. But of course, there's, like I said earlier, there's lots of different reasons for migraines, and this is only one of them. But it does seem to explain quite a few.
Okay, brilliant. Well, it seems that migraines are actually very complex, and that ties in with one of the reasons we are different at the OHC, because we like to unravel complexity rather than just treat the one thing or eliminate tyramine, as some people would do, just avoid all sources of tyramine. So what would you do as an OHC practitioner with somebody who presents with a migraine?
Well, it goes back to the fact that we need a full health history, the first consultation and follow-up consultations where we're asking a client in great detail about their symptoms and when they're occurring, and like you said earlier, the food diary are all really important factors because they all give us clues, and that's what we're about. We're using our experience, the symptoms that the client is presenting with, and the scientific knowledge that we have to drill down and find out what for that individual is likely to be the cause and help them through. Because yes, just going off and doing a particular exclusion diet or whatever is actually quite hard to do. It's not always the right thing to do, and we don't want people coming off foods or taking supplements unnecessarily. That's why we take great care to work on an individual basis and do what's best for the individual patient.
Okay, well that sounds great. Thank you, Helen. And I'll be looking forward to finding out more about migraines, talking with you in the near future. It sounds like a really interesting subject. Thank you so much.
Thank you.
And thank you all for watching. If you are interested in migraines and any other subjects, keep an eye on our YouTube channel or visit our website, which you'll see on the subtitles on this video. Thank you so much again for watching today. Bye-bye.